Hello everyone, Assalamualaikum. We are now on Facebook Live of Columbia Asia. This is Doctors Go Live, and today we are talking about knee pain, because I guess everybody has a little bit of that if you are at a certain age, or maybe you have been playing sports so you have uncomfortable feeling in your knees. There are certain things that we can do actually. There are certain exercises. So with us to talk about this is our specialist, who is a physiotherapist at Columbia Asia Hospital Klang, Encik Tarmalinggam. Hi, how are you?
Yeah, I'm fine. Thank you. How about you?
Good, good. We're all good. Thank you so much. I'm working from home today. I can see that you are at your
Yes,
hospital
happy space.
in
Yeah.
Klang. I see. Okay. And you will be showing us some demonstration, right, today regarding how to
Yes.
handle knee pain.
So basically, we'll explain about knee pains, what are the means causes and symptoms and everything, and also what are the
Okay.
exercises can be done at home.
Okay, that's good. So we will be able to see a demonstration that will be carried out by Mr. Kalam. I mean, using a model, of course. And
Yes.
we can do all this at home, and hopefully it will help to improve our knee pain. Okay, inshallah.
Sure.
All right, so first question, maybe you can explain first what are the types of knee pain that physio can help.
Okay, I think before we talk about type of knee pain, let me just go through about the knee structure so it's easy. I
Okay,
think people can understand. So
okay,
knee joint is basically is with bones together with the ligaments, which is a
yeah,
ligament. We have four type of ligaments on over there and stabilized by muscles. And also we have a cartilage which is playing a very important roles in a knee joints with together with the lubricants, something like synovial fluid, which helping to move and bend the knee. Be able to move around. It's because of the synovial fluid which in the knee joint. Okay, when we talk, okay, these are the structure. Basically, we have three structure: bone, ligaments, and cartilage. As I mentioned previously, these are the structure where give a problem in a knee joint. So if there's any problem with ligament or cartilage or even a bones, it can lead to a knee pains. So just go through about knee pain, the type of knee pain which as a physiotherapy we can help to reduce or to improve their knee pain is the first one is about ligament. As I mentioned, ligament, okay, what is a ligament? Ligament is which holding the bones. Okay, we have like we have a thigh bone, we have a leg bone, right? So to hold these bones, we need a ligament, something like like it's like a plaster which helping to hold the bones. Okay, so in case if the ligament have injured, as I mentioned, we have a four ligament. I just mentioned. So just for knowledge, we call it ACL, PCL, MCL, and LCL. I think sport people are aware of these ligaments. If there's an injury over these ligaments, usually the symptom will be instabilities. Means they feel like the knee is loose, and sometimes they have a swelling. Pain is very rare because ligament usually don't cause you pain, but they will be swelling and instabilities. Okay, ligament injury usually if you see we have three type of grade. Usually grade 1 and grade 2 we go for doctor usually go for conservative management, whereby grade 3 usually go for surgical management. If a conservative management, usually it's about physiotherapists, lah, where they come for physiotherapy, we do a lot of exercises to strengthen back the muscles. Whereby surgical management, after surgical, usually is arthroscopy. Okay, once they done arthroscopy, here the physiotherapy role is a major role because we have to deal with the patient. We have to really work close with the patient almost for 3 months. Where in 3 months period, we will train up their muscle, we train up their walking patterns. Okay, all this we have to train up. So when you have a ligament injury, physiotherapist's role is very important. Number one. Okay. Number two of type of pain which we can treat is muscle pain. Okay. Usually around our knee joint we have a muscle, we have a tendon. Tendon is the ending part of the knee. Ending part of the muscle we call as a tendon. When the tendon or muscle have injured, okay, usually will cause you pain. Okay, the symptoms almost look like similar for all the cases, but it just we have to investigation is very important to find out whether it's muscle pain or ligament pain or it's a bone pain. So usually the muscle pain, usually they will have a swelling and then pain. So this kind of pain, usually we don't really start exercises, we go for pain management first. As a physio, we don't only looking on the exercises, we do have some treatment, like we use some electrical modalities, we use certain thermal modalities to relieve the pain. Once the pain has subsided, once the pain has reduced, then we go for exercises. Why? Exercise is very important to strengthen back the muscle. If you want to go back to your normal routine, you want to go back to your normal sport activities, you really have to strengthen back your muscle. Without exercise, it's really hard to go back to your normal daily activities. Okay, and then when I think I have to mention about cartilage. Cartilage is we have a meniscus. Okay, meniscus is really important. As I mentioned, you it's a very important role in our knee joint because meniscus work as a shock absorber, whereby is our body weight is absorbed by the meniscus. So imagine if the meniscus is injured, the meniscus is really injured and it's not working, it's not really doing their function. So the body weight is go to your directly to your joint, directly to your knee joint. So you will start to hurt, you start to have a swelling, you will start to have a severe pain. Sometimes you're unable to walk, you need some walking aids. This is where all these things is coming on. And
I
then overuse. When talk about overuse, I think everyone is known as osteoarthritis. I think arthritis is very common in our country now. No matter no matter if they are older or younger, osteoarthritis is very common. Whereby where that is happening there. Okay, and then dislocation. Sometimes you can see some kneecap dislocation, but it's very rare. But if it's happened, there's a lot of fracture will be involved, ligaments, cartilage, everything will be involved. So in this kind of situation, the pain will be more, and then sometimes they are unable to bend fully. No, the knee bending will be restricted. Due to this, their daily activity also will be restricted. And last one I'd like to mention is about obesity. I think nowadays obesity is increasing in our country. You have to remember that knee is really playing a important role where it's need to observe our body weight. Imagine your height and body weight is not equal, it's not giving a normal BMI, then you are in trouble actually. Lot of knee pain is caused by obesities. The risk is more on the obesity people. It's because of the weight. Because when your body structure is changing according to your body weight, what happens? Your knee is not really helping to observe. It's too much of pressure on a knee, which causing a lot of injuries. So these are
see.
the conditions where we can really help a lot of people to improve or to reduce their pain.
Okay. For the type of knee pain, because you were mentioning just now, there's pain to do with cartilage, tendon, meniscus, and whatnot, and then also osteoarthritis
Yeah.
and being obese. The kinds of knee pain that they all experience, would there be a certain set of exercises that can relieve the pain, or is it different for each condition?
Okay. Usually, most of the exercises are same, which they can do at home. These are the basic exercises. Today, I will show some basic exercises which easily they can do at home. No matter they have a ligament injury, they have a bone pain, they have a cartilage pain, they're still able to do all these exercises. So I think we can go through all the basic exercises.
So before we start, I would like to just remind viewers that if you have any questions regarding what we are discussing and also about the upcoming slides that we are going to see shown by Mr. Kalai regarding knee pain, of course. If you have any questions, just type your questions in the comment section below and we will address those questions on the spot by Mr. Kalai. Betul, Mr. Kalai?
Yeah, can, sure.
Okay. That's good. Okay, shall we just proceed and let's watch some demonstrations that you are going to show us regarding how to handle knee pain, especially when you are at home and you don't have the means to go to a physio place.
Okay, I think first video. This we call a static quadricep exercise. Okay, maybe you can take a note or even just take the name so that you can Google and see the exercises. Static quadricep exercise we call it SQE. Okay,
Okay.
this is the basic, very important exercise in all knee cases, whereby you have to place a towel, a small roll towel under your knee. Okay,
Alright.
once you place under the knee, you have to press your knee downwards. You have to give a downward pressure. What
Oh,
happens
I
when you
see.
give a downward pressure? Automatically, your ankle will go up. If you see in the video, you can see the ankle goes up. So I want your
Yes,
ankle, yeah, your ankle go up. The ankle position must be go up also. Must
I
be towards
see.
your knee. Okay.
Mm.
Okay. Very important things here I have to notice is I want you all to place your fingers near to the inner thigh of your knee joint. Okay,
Okay.
inner thigh of knee joint to feel the contraction. What happens? Some people will do, they will use their posterior thigh of means the behind thigh muscles, which is wrong. We want to focus on the anterior aspect of the knee muscles. Okay, so when you press downwards, giving a downward pressure, the inner thigh muscle must have a contraction. When you feel the contraction, means yes, you are doing correctly. Yeah? Okay. Once you are in this position, I want you to hold for 10 counts. Once you hold for 10 counts, you rest for a while. Then you have to repeat for 10 times. Okay. Usually we advise to do this exercise 3 times per day, means morning, afternoon, evening. Okay. I would like to
Okay.
mention also, in the event when you do any exercises, you feel the pain is increasing or the symptom is increasing, you really have to stop the exercises. Exercises should not produce any aggravating pains. It should not give you any pain. I think everyone is clear with the first exercises. We move on to a second exercise. Okay, this is we call as straight leg raising, which is called FLR. You can just Google it SLR. I think you easily can find out. Okay, remember all the exercises which I'm going to show you today. You have to start with the first exercise, which is you have to press your knee downwards. Why? Whenever you do any exercise, make sure your knee must be straight line. You should not bend your knee. What happens when you bend your knee? You are not using the correct muscles. So you are doing exercise, but you are not strengthening the accurate muscle. So make sure your knee is straight. Once you press down towards, you give it a pressure towards downwards. You lift up your leg up. Maybe around 30 degrees is good enough. So you hold in that position for 10 count. Once you count for 10 seconds, you go down, rest. Same thing, you have to do for 10 times, 3 times a day. Move on to our third exercise. Okay, this one also we call as straight leg exercises, but then we have some modification here, whereby you have to lift it to the 30 degree, but you have to turn your leg towards outside. So here you will feel the contraction on the inner thigh muscle, the whole muscle. Okay, you have to feel the contraction on the inner thigh. Same thing, once you went to this position, hold for 10 count, repeat for 10 times, do for 3 times a day. And this sometimes will be quite difficult, but slowly you have to try. Like if you feel like it's difficult to do the exercises, try to do 5 times first, then slowly go for 10 times. Move on to our fourth exercise. Okay, same thing. This also category under straight leg raising, but we call as T-shaped straight leg raising. Okay, in this exercise, you don't need to hold. You just have to press, give downward pressure, lift up your leg up, go in, out, middle, down. I think it's very clear the video. Go in, out, middle, down. You don't need to hold any position. I mean, you need to count for 10 count. You just straight away can do in, out, middle. Go for 10 times also. Move on to number 5. Okay, this one we call as heel slides. Okay, this exercise is mainly people who feel difficulty to bend the knee fully. Okay, when you have a knee pain, as I mentioned before, when you have some condition, we have a difficulty to bend your knees, especially after surgical management. What happens? Some people when they unable to bend the knee, they just leave it like that. Cannot. If you leave it like that, what happens? You will have a secondary complication like joint stiffness, muscle stiffness, and everything will form. To avoid all this problem, you have to do these exercises. So you just have to bend your knees slowly up to your pain-free range. I mean, if you feel like you are bending your knee, you feel after 60 degrees you're having a pain, you just stop it. Go to normal position again. Bend. Slowly, you have to gradually, you just do every day, every day. In one point, you can reach the full range rating. Okay. Move on to our sixth exercise. Okay. Otherwise, we are explaining about more on strengthening exercises. Now we go for stretching exercises. This consider stretching exercises. Sometimes muscle tightness can cause knee pain. As I mentioned, not only injury, sometimes when you have a very tight muscle, your thigh muscle are very tight, it can cause a knee pain actually. So here we have to do a stretching. This is called hamstring stretching. Means we are stretching the lower part of, I mean the posterior aspect of the thigh muscles. Very simple. Take a towel from your house, just place under the ankle. Okay, you have to give in pressure. You just pull it, lift up. Make sure your knee must be straight. Whatever exercise you are doing here, make sure your knee is straight. But here, stretching exercise I usually advise to hold for 15 count minimum. Strengthening we hold for 10 count, but stretching we hold for 15 counts. Because why? In 10 seconds, now if you hold for 10 seconds, then only the muscle have stretched. It's not enough. You have to go more than 10 seconds to really stretch the muscle. You can go up to 30 seconds, no problem. If you're going for up to 30 seconds, maybe you can repeat for 5 times. If you're doing for 15 count, you can go for 10 count. Move on to our next exercise. Okay, this we call IT band stretch. Okay, note here IT band stretch, which is this is basically IT band is a muscle where it's attaching the outer part of your thigh muscle. Sometimes when you have a very tight IT band muscle tightness, you will have definitely will have a knee pain. It's not you're having a knee problem, but because of your muscle tightness, you might have a knee pain. To stretch the IT band is very simple. Same thing, you have to place a towel under the ankle. Now you have to move your leg towards inner side of your body. Once you move, hold for 10, 15 count, can repeat for 10 times. Okay, these are last exercises. This we call as pro knee exercises. Okay, as I mentioned, our thigh is consist of two muscles we call as quadriceps muscle, which is attaching the front part. This behind part which is called hamstring muscle. These two muscles are working together to prevent your knee pain. Okay, to strengthen your hamstring muscle, you have to lie down face down like this. You slowly have to lift your leg up. Okay, you really have to feel the contraction on your muscles, hold for 10 count and repeat for 10 times. So all these exercises you have to repeat for 3 times per day if you can. Okay, these are the basic knee exercises. So once you have done, like for example, you are doing for 1 week continuously. After 1 week, you slowly can add on some sandbag, 1 kg sandbag or 2 kg. Slowly you have to add on some weight to improve, to improve your muscle strength actually. You
The
start with
sandbag
zero
is
weight. Yes, you start with zero weights without any weights. You just keep doing for 1 or 2 weeks. Once you feel like you are okay, you are able to perform all the exercises. Slowly, you have to add on. You have to increase the weight. Means you have to add on 1 kg. You have to make your muscle to adapt with the 1 kg. Once your muscle are adapt with 1 kg, you go for 2 kg. Slowly, you have to increase the exercises. I mean, the resistance.
I see, I see. Okay, those look very easy actually, the exercises. So these are
These are
some movements that you can do at home. Yes, you don't have to
yes.
go to a physio center if you cannot go out of the
Yeah.
house, for example. So thank you very much, Mr. Kalai. So those were the demonstrations. It's very doable, I must say. Okay, about doing physio, if you are at home, when you follow these demonstrations, when should a patient go see a doctor, or you can just deal with this at home? What do you think?
Okay, very simple. When you have to see doctors, okay, when you have a symptom like swelling, number one, pain, and pain is unbearable pain. sometimes you feel like you're unable to, difficult to bend your knees, when you feel like redness on your knee joints. Okay, when I, especially if you spot people when you're playing a field, you found you fall down, you have had some pop sound, we call it a pop sound, you really immediately have to see doctor first. Okay, as I mentioned here, not all the condition have to start with exercises. Some condition they need treatment first. Once they done the treatment, then have to go and see doctor first. Okay, why I say I have to see doctor first? See, when you see a doctor, they can evaluate better. Okay, they sometimes do some investigation like X-ray, MRI, which can give an accurate answer, which is your problem, whether your ligament problem, your cartilage problem, your bone problem, or is it muscle tightness. So when we know which area is your problem, it's easy for us to plan our interview, our plan, our treatment. Whether this patient need to do exercise first or this patient need to do a treatment, physio treatment, like as mentioned earlier, like we have ultrasound, TENS current, we have hot and cold packs, and we slowly go for exercises. So for us to determine the plan of treatment, it's always better to see a doctor first when you have a symptom like pain, swelling.
Okay, yeah. You mentioned just now, Kalai, that when you are doing the exercises, you should not feel pain, right? Because these exercises are supposed to reduce pain.
Correct.
But you
When they-
already have knee pain, and as you are starting to do the exercises, if you feel okay, then it's okay lah. But if you still feel pain, so that's when you should see a doctor and not rely on your home exercises, correct?
Yes, correct. Because all the exercises should not produce any pain or
Correct.
increase the pain tolerance. Means if you find out, no, after I've done all the exercise, I feel the pain is more compared to normal,
Yeah.
then you have to
Yeah.
stop. Better to you to see a doctor.
Okay. All right. Understood. Can exercises help with knee pain without us taking medication?
Okay. As I mentioned, there's lot of conditions. So most of condition you really have to go with medication with physiotherapy treatment. But there's some condition like ligament injury. As I mentioned, ligament injury usually they
Yeah.
don't have pain, but they have instabilities. To
Mm.
prevent the instability, we have to strengthen back the muscle. So usually doctor
Right.
will advise to go, they will give some normal pain relief
Yeah.
medicine. Not necessarily they have to take the pain relief medicine. They just have to do exercise. But in this kind of exercise, we have to go for more advanced exercises where they have to come and see physiotherapists. But most of the condition, yes, they have to come with medication together with physiotherapy will help more.
Okay, I see. But these are prescribed medications, like, which of course you need to go and see a doctor.
Yes.
But what if it's something that you can just get from the pharmacy, for example, painkillers? Would that be also something that can help with your pain,
Okay.
or it's enough with your exercises?
Painkiller should be okay if you feel like you're tired, you're having a knee pain, very severe knee pain, you want to take some painkiller like no myomel or something, it's okay to take, no problem. But as I mentioned, if you find your symptom is not reducing, it's better to see a doctor rather than you're taking your own medications. And the
The
same thing,
own medication will also involve macam minyak angin. Sometimes they sapu
yes,
urut the kaki,
because
and it can also be
yeah,
hot pack, warm packs.
correct. Because what I found out, sometimes you don't know what is your problem. You find okay,
Yeah.
it's just a normal swelling. You just suppose some, like minya, like
Yeah.
some oil. Sometimes all this can aggravate the problem. Some people will go for massage and everything without knowing what's the problem and end up with a very severe knee pain. I have seen a lot of patients like that. So my advice personally, don't whenever any pain, no matter it's a knee pain or any other part of pain, don't go for straight for massage and everything. Better see a doctor or do a proper treatment.
Okay. In that case, doctor was just sorry, physiotherapist. Kalai. If you have any knee pain, let's say you already have an existing pain, like in your knees, and you are at home, but maybe there are certain movements that you should not do. If you work out, for example, some of us like to use the skipping rope and jump. Some of us do dancing, where there's a stomping movement, which can be a little hard on the knee, I suppose. And then of course there's the daily daily movements like going up and down the stairs and all that. So maybe you can give us some examples of what somebody with knee pain should not do when they're at home.
Okay, sure.
Or just
Okay.
maybe when they're driving also, if you tekan the accelerator pun, sometimes kan if you have knee pain.
Okay, very simple. Okay, when you have a knee pain, there's some activity you have to avoid, especially high impact exercises. Even exercises, they have a low impact and high impact, right? So high impact like jogging, jumping, as you told me, trampoline, all these you have to really have to avoid, because when you have high impact exercises, you are doing high impact exercise during your knee pain, you will be aggravate your pain. Number one. Number two, try to avoid your deep squatting, lunges. Some people will see some video, they will try to do all these exercises, but it's not good at all. If you're having a severe knee pain and you're doing lunges, you're doing squatting, you're really going to aggravate the pain. Okay, so try to avoid high impact exercises. If you're athlete, you injure your knee during your sport activities, I will say stop your sport activities, because we don't know whether your ligament is fully torn or partially torn. If it's partially torn or fully torn, you have to really have to give a rest for a few months. Then you can go back to your sport activity. So it's depending where is your injury happen, but try to avoid your high impact exercises and sport activity, especially when you injure your knee.
I see. Okay. What about going up and down the stairs? Is that something to be worried about, especially if you are elderly?
Okay. Okay. If you see, I have mentioned a lot of conditions, right? This going up and stairs and going downstairs usually have pain for people who are having a problem with this called is a patellar femoral syndrome. Means they have a problem with the kneecap. If you say they have a kneecap, right? When you have a problem in the kneecap, then you have a difficulty to go up and down staircase. Other conditions should be okay going up and down staircase,
Right.
but only in the kneecap problem, we don't really advise go up and down staircase, because the pressure over the knee will be more. When you go up and down, the kneecap is moving up and down, so it will aggravate your pain. So this, if you're having a problem in a kneecap, try to avoid staircase. Other problems should be okay, but still depending on the level of injuries, because we have a safe stage, right?
Right.
Depending, you have to know where which stage you are. According to you have to.
What about sitting on the floor? For whatever reason, sometimes we find that we need to sit on the floor. For Muslims, for example, their prayers require for them to sit a certain angle, folded knees, on the left side. And then sometimes when you have knee problems, you find it a bit painful and uncomfortable if you were to bring yourself up again.
Okay, correct. As I mentioned, people who are having a knee pain, they have a difficulty to bend their knee fully. So kneeling down is definitely will be a problem, and getting up from the kneeling position to up is really a problem. It will cause a severe pain. So what I can advise in these cases, try to modify your lifestyle. A certain stage, you have to really have to modify your stages. For example, as I mentioned, a prayer try. Usually, what we advise is you go for sitting position. You sit
Yes.
and do a prayers. Same, it's in all activities. You have to really have to modify your daily activities. Even I like to inform that even a shoe playing a very important role in the knee pain. You have to wear a proper shoes. If you're having a knee pain, make sure you get a proper shoe where the insole have to be cushioned smooth. You should not wear a flat or high heels. You have to really have to avoid. Sometimes wearing high heels or flat shoes can cause you a knee pain. So even shoe is a really an important role in a knee pain.
Yeah, actually, for high heels, yes, I think we're mostly aware that high heels should not be worn all the time, and they cannot be very high because it can actually
Yes,
cause you
correct.
pain. But I don't think I've ever heard of wearing flat shoes that can actually damage your knees. So, what kind of flat shoes are the ones that we
What
should not wear?
Okay, what I mean is when you have a knee pain, try to get a shoe with insole. Okay, if you really notice our ankle will come with some arches, right? It's not
Yeah.
our ankle is not flat. So try to get something with arch support shoes,
Yep.
which must be a cushion, smooth, not hard, because you're giving a pressure on the shoe. When you have flat shoe, your arch is not supporting. when there's some gap, see, wherever in our body affects some gap, when you're wearing shoe, a flat shoe, there's some gap, there's some pressure there. The pressure can produce a pain or ankle, knee, because it's all are working together actually.
Okay. So I think we have come to the end of our discussion, but if you would like to add anything else, Kalai, you are welcome to. In the meantime, if viewers have any questions, you can always type it in the comment section below, and we will try to get Kalai to answer those questions right away. Okay, we have our first question here from Miss Alia Azizan. Mr. Kalai, if I experience knee pain, could it be that I'm lacking calcium?
Yes, if it's elderly people, sometimes yes, sometimes because of the lack of calcium, you might have a knee pain. But I don't advise, because some people what they will do, they will straight away go because knee pain. I don't have the calcium. They straight away take calcium. No, you have to find out
Right.
whether your calcium level is correct or not, is it stable or not. You have to take calcium because if high calcium is you're having problem. So you really have to find out. Yeah, it cannot be high calcium. If it's too much of calcium, so you tend to have some extra bone in your joints.
Oh, I see.
So to avoid this, it's better to you to consult with doctor first whether your calcium level is okay or not, because degeneration is happening, right? Once you reach 30 and above, your degeneration starting. Degeneration means joint is getting like the space is reducing, all this osteoarthritis is developing in the age of 30 and above. So there's a chances for calcium reduction can have a knee pain, but it's better to check first whether your calcium level is correct, okay or not, normal or not.
And you have to check that at the hospital by doing the there's a test, bone density test. Is that the one for you to check the calcium level?
Correct, correct. Bone density test is there to check your level of, bone density. Even if you lack of your bone density is less, it can cause a knee pain.
Okay.
Even
Any other
even
any other
diabetes,
way for you to check calcium? Is that something that you can just do at the pharmacy? What I'm saying is, do you have to go to a hospital to check your
usually,
calcium level?
yes, I think usually in the hospitals.
Oh,
Pharmacy, I don't think so. Yeah.
okay. All right. Okay. So only take calcium pills when you need them, and not as a set of
Yes,
like
it's
daily
correct.
supplement habit.
Yes.
Some people can take
And you
all,
need to go for
including
calcium
calcium, when perhaps they
because
don't really need it. So that's something good that you brought up just now. Only if necessary, lah.
necessary is correct.
Yeah.
Even
Okay.
diabetes patient can have knee pain. Sometimes it's okay. You have to understand knee pain is not like it's a primary function, but sometimes secondary function is that means you have a knee pain because of another problem. Means your problem is different, but you having caused a knee pain. For example, I can say about diabetes patients. When your
Yeah.
diabetes, your sugar level is not normal, your sugar level is too high and high. What happens? You are damaging your bone, your muscles, you're damaging your cartilage and nerve. So this can cause a knee pain. Even if you have some infection in your body, you can have some multiple joint pains, knee pain, joint pain. It's not necessarily you're having a knee pain because of your knee problem. It can be another problem also.
I see. Okay. Well, we hope that answered Miss Alia's question. Let's see if we have any more questions. Okay, we have one from Siti Akila Syed. Who is more prone to get knee pain, males or females?
Okay, very good questions. Okay, if you ask me, knee pain is more prone to female compared to
Oh,
male.
why is that?
Okay, the reason is okay. Number one, that's a lot of reason. Okay, I think very easy to everyone to understand is okay, the structure of the body. If you really notice, girls the hip joint to the knee joint, their hip is wider compared to male hip. Am I right? So what happens because of the hip wider? What happens? The stability of a knee is reduced. Means their stability of knee is less compared to the male. Because of the body structures, they are more prone to the knee pain. Another one is because of hormonal changes, which female have a menstrual problem, right? Menstrual cycle. During this menstrual cycle, what happens? They are tend to have a ligament injury easily. So during menstrual cycle, you are not active in the sport and everything. Try to avoid because if you fall down, you can easily can have a ligament injury. So these are the reason why females are more prone to compared to male.
Okay, all right. So we have to be careful there, lah. Okay,
Yes,
all
correct.
right. Let's see if we have any more questions. Okay, oh, wow, that's a long one, from Ms. Josephine Siu. Good afternoon, Mr. Kalai and Madam Sakina. Thank you for a good session. I am a marathoner and had developed runner's knees. My MRI showed degenerative arthritis of my left knee. I had stopped running during the acute phase, but slowly resuming. What sort of exercise would you recommend to strengthen my leg muscles? Thank you.
Okay, thank you for the questions. Okay, if it's okay, this is for all the sport people, huh? People are really no, they really want to do a lot of sport activity. They're active in sport, football, no matter it's a runner or even kickboxing, all the all the activities. But they're forgetting about one thing about exercises. They're thinking that even doing a sport activity is good enough to maintain the muscle. It's not, because when you do any sport activity, you're overusing the muscle. So what happens? You're overusing the muscle again and again and again, and you're forgetting to strengthen back your muscle. That's why all is arthritis. Even nowadays, I think 16, 20 years girls and boys are getting arthritis. Very common it is because of the sport activities. So I would recommend when you're active in sport, don't forget about your exercises. This kind of people really need advanced exercises, like you're going to gym, leg press, cycling, treadmills. You have to go for an aggressive or more resistant exercises. Like whatever we showed was a basic, right? But this exercise is more to normal people. But you are active in sport, you are really an athlete. Try to go gym. Try to do a lot of leg strengthening exercise. As I mentioned, leg press will really help you a lot. Squatting downs. Before you have all this problem, you have to really have to work out. So sport and exercise must come together to prevent your knee pains. All
I
this
see.
knee.
Okay. For those who do just regular sports, I'm not as a professional or not as a marathoner lah. If they how is it that they so that they don't get knee pain in future? Like you said, young people who just like to play sports for leisure. Would warm-ups actually help the
Yes,
situation?
of course. Yeah. Whenever you do any activities, no matter it's any sport activity, remember warm up and cool down is very important. Without warm up, you
Oh,
are doing any exercises. For example, you're going for running, you're not warming up your muscle, you straight away run.
yes.
Definitely, believe me, you will have a very severe muscle pain. It's because you're not
Oh,
warming up. So you have to warm up your muscle first. Then only you
yeah.
have to go for sport activity. Same goes.
Okay.
Once you really have to, you have to work out. You really overuse the muscle. You have to cool down your muscle again.
Okay.
So warm up and cool down is really very important. Try to take at least 15 minutes to do warm up. Same goes for cool up, cool down. You really have to
Okay.
do it for 15 minutes.
Okay, so that's really important, yeah, the warming up and the cooling down. Okay, it doesn't look like we have any more questions. So I think that's all for today, Mr. Kalai. Thank you so much for your time. That was Mr. Kalaimanan Tarmalinggam, physiotherapist from Columbia Asia Hospital, Klang, who had spoken to us about how to handle knee pain. And if you had missed the demonstration that we showed earlier about exercises that you can do at home, you can always watch this video later after it has aired live. Okay, thank you very much. Bye everyone.
Thank
See you
you.
again.
Bye. Have
Thank you,
a nice
Kalai.
day.
Bye.
Okay, bye.